1. Which of the following is the most important element of adult learning theory? A. Immediate feedback. B. Active participation. C. Structured lectures. D. Rote memorization. 2. When evaluating the effectiveness of a healthcare training program, which metric should be prioritized? A. The number of participants. B. Participant satisfaction. C. Knowledge retention. D. Cost of the program. 3. Which of the following is a key principle of the constructivist learning theory in adult education? A. Relying on passive learning techniques. B. Learning based on experiences. C. Memorization of content. D. Focusing solely on theoretical knowledge. 4. Which method of assessment best aligns with the goal of measuring long-term skill retention in healthcare professionals? A. Multiple choice tests. B. Simulation-based assessments. True-false exams. D. Short answer quizzes. 5. What is the most effective way to ensure compliance with healthcare regulations during training? A. Providing a theoretical overview of regulations. B. Using real-world case studies. C. Relying on self-assessment tools. D. Allowing flexibility in course content. 6. What is the purpose of formative assessment in a healthcare training program? A. To grade participants at the end of the course. B. To provide feedback and guide learning during the course. C. To determine the overall success of the program. D. To evaluate financial aspects of the program. 7. Which of the following is a barrier to effective mentoring in healthcare settings? A. Clear communication channels. Adequate support from senior staff. C. Time constraints and workload pressures. D. Regular performance reviews. 8. How can an instructor best foster critical thinking in adult healthcare learners? A. Providing step-by-step instructions for tasks. B. Encouraging learners to analyze and reflect on case studies. C. Focusing on rote memorization of key facts. D. Limiting discussions to theoretical concepts. 9. When developing a curriculum for healthcare professionals, which of the following should be prioritized? A. Meeting accreditation requirements. B. Ensuring the content is up to date and evidence-based. C. Including as many topics as possible. Using a one-size-fits-all approach for all learners. 10. In adult learning, what does the principle of self-directed learning emphasize? A. The instructor taking control of the learning process. B. Learners taking responsibility for their own learning. C. The need for external motivation to succeed. D. The exclusion of personal experiences from the learning process. 11. Which of the following best describes the andragogical approach to adult education? A. Teacher-centered instruction. B. A collaborative learning environment where learners contribute. C. Focus on memorization rather than understanding. D. Passive participation from learners. 12. What is the key benefit of using peer evaluations in a healthcare training program? A. It provides an opportunity for participants to compete. B. It allows participants to gain different perspectives on their performance. C. It saves time and resources. D. It removes the need for instructor feedback. 13. How does active learning support adult learners in healthcare training? A. It engages learners through practical activities and problem solving. B. It focuses on delivering theoretical lectures. C. It relies on memorization techniques. D. It encourages passive listening rather than participation. 14. When developing a mentoring program for healthcare professionals, which factor is most important for its success? A. The age of the mentor. B. The level of professional experience of the mentor. C. The use of standardized mentoring materials. D. Establishing clear expectations and goals for both mentor and mentee. 15. Which of the following is a characteristic of a well-structured healthcare curriculum? A. Focus on theory alone. Lack of flexibility. C. Incorporation of real-world scenarios and case studies. D. Minimal use of technology. 16. What should be the primary focus of assessment in a healthcare training program? A. Testing factual knowledge only. B. Evaluating clinical competencies and practical application. C. Grading based on attendance. D. Providing a comprehensive theoretical exam. 17. Which of the following is an essential component of effective communication in healthcare training? A. Using medical jargon to show expertise. B. Listening actively and providing constructive feedback. C. Minimizing interaction with participants. D. Limiting the use of visual aids. 18. Which of the following is a sign of ineffective adult learning in a healthcare training session? A. Active participation and feedback. B. Low retention and disengagement from the content. C. Regular application of learned concepts in practice. D. Frequent use of case studies. 19. Which regulatory body ensures the certification of healthcare professionals in the United States? A. American Medical Certification Association AMCA. B. American Board of Medical Specialties ABMS. C. Centers for Medicare and Medicaid Services CMS. D. National Institutes of Health NIH. 20. Which of the following is a primary goal of competency-based healthcare education? A. Ensuring learners acquire a certain amount of knowledge in a specific time frame. B. Developing learners' skills in real-world healthcare tasks. C. Focusing on theoretical knowledge over practical application. D. Standardizing all healthcare training programs across the country. 21. What is the best approach to evaluate the effectiveness of a healthcare curriculum? A. Administering final exams. B. Collecting feedback from learners, instructors, and stakeholders. C. Focusing on the financial cost of the program. D. Monitoring the time spent in each session. 22. How does mentoring in healthcare help new professionals develop essential skills? A. By providing one-on-one guidance and support from experienced mentors. B. By focusing only on theoretical knowledge. C. By excluding feedback and allowing free practice. D. By teaching solely through lectures. 23. What is the role of a mentor in a healthcare training environment? A. To judge and critique learners. B. To guide and support the learner's development of professional skills. C. To conduct all assessments and evaluations. D. To deliver the entire training content. 24. How can a healthcare curriculum best address the diverse learning needs of adult learners? A. By offering the same content to all learners. B. By incorporating different learning styles and offering flexible learning options. C. By limiting content to a single format. D. By using only theoretical knowledge. 25. Which of the following is the best strategy for developing a learner-centered approach in healthcare education? A. Providing clear objectives and allowing flexibility in achieving them. B. Focusing solely on instructor-led lectures. C. Using a standardized test to measure success. D. Restricting learner input and feedback. 26. How can an instructor ensure that adult learners retain information effectively? A. By focusing on lectures and passive learning. B. By encouraging learners to actively engage with the content and apply it. C. By limiting the use of real-world case studies. D. By providing minimal feedback. 27. What is a key challenge when mentoring healthcare professionals? A. Ensuring consistency in assessment. B. Balancing workload with available time for mentoring. C. Providing immediate feedback. D. Teaching a wide variety of theoretical concepts. 28. Which assessment type is most appropriate for evaluating practical healthcare skills? True-false tests. Written exams. C. Simulation-based assessments. D. Oral presentation. 29. What is the importance of continuous professional development for healthcare professionals? A. To remain compliant with regulations. B. To maintain and enhance professional competencies throughout their careers. C. To avoid job-related stress. D. To earn more money. 30. Which of the following is an important consideration when designing a healthcare curriculum for adult learners? A. The complexity of the content. B. The age group of the learners. C. The learning preferences of the participants. D. The duration of the training sessions. 31. How does providing feedback in healthcare education support learners? A. It helps reinforce correct behaviors and correct mistakes. B. It encourages learners to memorize information. C. It discourages further learning. D. It provides external motivation. 32. What is a common method used to assess the quality of healthcare education programs? Peer reviews. B. Exit surveys from learners. C. Direct observation of clinical performance. D. Financial performance analysis. 33. When developing a curriculum for adult learners in healthcare, what is the key to its success? A. Length of the program. B. Learner engagement and applicability to real-world situations. C. Number of theoretical sessions. D. Use of only one form of assessment. 34. What role do case studies play in healthcare training programs? A. They provide hypothetical situations for learners to analyze and apply their knowledge. B. They focus on theoretical knowledge. C. They are used only for theoretical tests. D. They are not useful for real-world training.